Hola, gracias por regresar a nuestra serie. Mi nombre es Rogelio. Ahí estoy aquí con un invitado especial.
I'm Austin. I use he, him, or they, them pronouns, and I'm the PrEP navigator here at HeyDenver.
Y el día de hoy estaremos hablando sobre algo que Austin se especializa. Vamos a hablar sobre PrEP. Entonces, Austin, ¿quieres empezar el video? ¿Qué es PrEP?
Yeah, so PrEP stands for pre-exposure prophylaxis. It's medication used to prevent HIV, and it's a great choice for anyone that enjoys activities that could put them at risk for HIV.
¿Y cómo es que funciona este medicamento tan especial?
Yeah, so PrEP works by, since you take it before you're potentially exposed to HIV, it's able to build up in your body. So if HIV ever is introduced to your system, it can't make copies of itself, meaning it dies and infection is not successful.
Tengo varios amigos que están tomando PrEP y me cuentan sobre algunos efectos secundarios y me da un poco de miedo si quiero empezar el medicamento. ¿Me puedes explicar un poco sobre esos efectos secundarios?
Yeah, so like most medications, PrEP can have some side effects. Most commonly that looks like short-term stomach pain, mild headache, stuff like that. But your doctor can make sure to choose a choice for PrEP that's going to be best for you with the least amount of side effects. And it is considered safe.
¿Cómo sé si la PrEP es algo adecuado para mí? Yo siento que a veces no estoy teniendo varias parejas sexuales. Siento que PrEP tal vez no sería adecuado para mí. ¿Cómo sé si es para mí?
Yeah, so PrEP is right for anyone who enjoys activities that could put them at risk for transmitting HIV. Examples of that would include having multiple sexual partners, being inconsistent with other forms of protection like condoms, sharing equipment to inject or prepare substances is even a risk for transmission as well. So if any of those things are things that you participate in or you just want extra reassurance for yourself, PrEP can be a great choice.
Siento que estoy listo para empezar PrEP. ¿Cómo es que puedo acceder a este medicamento específicamente aquí en el estado de Colorado?
Yeah, so accessing PrEP in Colorado is actually a little bit easier than it is in some other places. If you have insurance, your insurance will cover the entire cost of your PrEP. If not, there's also a state program called PHIP, which stands for Public Health Intervention Program, that can act as PrEP insurance, essentially. That'll cover all of the costs of your services, and PrEP navigators like myself are available to help folks either navigate their insurance or apply for PHIP. So if anyone needs assistance, they're welcome to reach out to me, or there's a team at Servicios de la Raza that can also help folks in Spanish.
Claro. Personas como Austin están listos para ayudar a través de todo el estado. Entonces PrEP es algo muy accesible aquí, afortunadamente. Una pregunta para clarificar información que he escuchado. También he escuchado de algo que se llama PEP. ¿Qué es la diferencia entre PEP y PrEP?
Yeah, so PEP stands for post-exposure prophylaxis, meaning it's used after a potential or known exposure to HIV, versus PrEP, which is used beforehand. It's kind of like if you think of birth control, PrEP is similar to birth control as you kind of classically think of it, and PEP would be more like the morning after pill or Plan B.
Okay. Entonces, información que hay que tener en cuenta, ¿verdad? PrEP antes, PEP después. ¿Y cuándo es que puedo usar PEP? ¿Puedo usar PEP después de cada interacción sexual o no?
Yeah, so if you have an encounter that you're concerned about, either you didn't have an opportunity to discuss your status with your partner, or they informed you after the fact that they were living with HIV, or even if you just left it feeling uncertain about things, you're welcome to talk about PEP with a medical provider within 72 hours. It's very important that you start within 72 hours because that has the best chance of it being effective. Other circumstances when PEP might be a right choice for you is if you have an accidental needle stick, or if you have shared equipment to inject or prepare any substances.
Claro. Después de hablar con un proveedor médico, si decido que PEP es para mí, ¿dónde lo puedo acceder?
So in the Denver area, you can get PEP at the Colorado Health Network Medical Clinic, which is associated with HeyDenver, or you can go to the Denver Sexual Health Clinic, which is on Denver Health's campus. Either option is going to be a great resource. And then for folks outside of Denver or people seeking PEP outside of regular business hours, a local urgent care or emergency room tends to be the best option.
Okay, entonces sí existen varias opciones para acceder al medicamento.
The most important thing you should know is that there are plenty of resources available in Denver and in the state of Colorado broadly to help people get connected with PrEP. PrEP navigators like myself are a great resource. We can help folks in whatever language they prefer, and we can help folks throughout the entire state. So if anyone wants assistance with this process, they're welcome to reach out to our team or the teams at local HIV service organizations near them.
Austin, yo tengo varios amigos que son hombres gay. ¿El medicamento es solo para ese grupo? ¿Y existe un límite de edad para acceder al medicamento?
PrEP is commonly used by men who identify as gay or queer, but anyone who's at risk for HIV transmission can use PrEP. The only requirement to access PrEP is that you weigh at least 77 pounds. But otherwise, there are no age restrictions, no sexual orientation requirements, gender identity restrictions, anything like that.
Wow, entonces cualquier persona que quiera PrEP lo puede acceder.
If you want to learn more about PrEP or PEP, you can check out our webpage, which is heydenver.org/prep-pep, which is available in English or Spanish.
Oh. I was gonna go ahead.